Basic Medical Billing in the Dental Practice. This is an introductory course that is applicable to services performed in both general and specialty practices, and it covers a wide variety of procedures that are basic to every practice. It includes examinations, radiographs, appliances, impacted teeth, sleep apnea, and related services. Let's look at some typical situations that are encountered in the dental practice on a daily basis. Imagine the situation where a patient presents to her MD with a high fever, facial swelling, partial closure of the right eye, and an inability to fully open her mouth. The physician performs the exam, a diagnosis of facial cellulitis is made, and he suspects it is due to a periapical abscess. The patient requires an immediate incision and drainage and insertion of a Penrose drain. Patient is referred to the emergency room. Do you think that the hospital will bill the dental plan? And why not? Is it because the patient showed up at the hospital? Think about it. What about this scenario? A patient presents to her physician with pain, lymph node swelling, limited jaw opening. An exam is completed, a diagnosis of possible impacted teeth is made, the patient is prescribed antibiotics and pain meds, and is advised to see a dentist or an oral surgeon for further evaluation, radiographs, and extractions as needed. Will the physician bill the dental plan for this visit? And why not? Because they don't know how to go about it? Think about that for a minute. What about this scenario? A mother drags her teenager to the pediatrician with complaints that the child keeps getting cold sores on his lip. The pediatrician evaluates the child and makes a diagnosis of herpes simplex 1 and prescribes Zovirax. Do you think the MD will bill this visit to the dental plan? It's an oral problem after all. So you have to ask yourself, why is our office billing these medical procedures to dental plans? Is it because you believe that only physicians, hospitals, and surgical facilities can bill medical plans? Is it because you think it's illegal for a dentist to do so because dentists are not real doctors? Don't get me started on that one. Is it because you've tried billing medical plans in the past and you've received EOBs that state dental treatment not covered or medically unnecessary treatment? Is it because you think that the only dentists that can legally bill medical plans are oral surgeons? Or is it because dental schools don't address it and you therefore think it's shady or illegal to do so? Well, guess what? None of those statements is true. It is legal and possible for any dentist, whether a general practitioner or a specialist, to bill medical plans and get paid for their services. You just have to play by the rules. Here's a copy of the federal anti-discrimination law that addresses the issue that medical insurance plans cannot discriminate based on the degree of the provider. If a procedure is covered by a plan, it must be paid for, no matter who the provider is, as long as they're licensed and trained to do the procedure. That is covered by the plan and thus billable. You have to know what the rules and the requirements of medical billing are. Keep in mind that medical insurers make the rules. You can either attempt medical billing by trial and error in the hopes that you will eventually figure it out, which you've probably done already with little or no success, or you can learn what the rules and requirements are. Medical billing does not require any shady tactics nor fraudulent moves on your part. In fact, those actions will only result in getting you into deep doo-doo. All dentists can legally bill medical plans provided that, number one, They're trained and licensed to do the procedures that they are billing. Number 2, they are coding exactly what has been done, and there's no creative billing taking place. And number 3, they do not hide their degrees or misrepresent themselves. This is in detail the federal law regarding non-discrimination in healthcare when providers, no matter what the type, are concerned. Notice the language. A group health plan and a health insurance issuer offering group or individual health insurance coverage shall not discriminate with respect to participation under the plan or coverage against any healthcare provider who's acting within the scope of that provider's license or certification under applicable state law. Your office already does that when billing dental plans, right? You're only billing for things and procedures that you are trained and licensed to perform. So let's get started. Basic medical billing in the dental practice. How is it different from billing to dental plans? First of all, the codes are different. Medical billing has 2 coding systems. You cannot use dental codes on a medical claim form, although there are rare exceptions. The claim form is different. You cannot submit procedures to a medical plan using a dental claim form. That results in an automatic rejection. The documentation requirements are different. No dental chart notes, dental or periodontal charting, or narratives are acceptable forms of documentation when billing medical plans. The pre-certification process is also different. You cannot submit codes on a claim form. When you receive a response, you receive it either online or by fax within 24 to 72 hours. Written authorizations are provided for procedures without dollar amounts provided, although there is a way to give a patient a fairly accurate estimate. The benefits and rules are also different for in and out of network providers. Keep in mind, though, that should you decide to become an in-network provider, the write-offs can be huge. The medical billing process also requires an active involvement by both the clinical and business teams. If either one does not fulfill his or her part, your office will not be successful with the medical billing process. Doctors must be actively engaged in this process because the documentation preparation cannot be left solely up to the business team. They don't have the clinical knowledge or background. A symbiosis must exist between both parties, the clinical end and the business end, in order for your office to be successful at this program. Medical billing also requires a very clear head. You have to be focused, especially when first starting. You cannot have the biller answering phones, working with patients on scheduling, discussing finances, and going back and forth to medical billing. Things are not going to go well. Mistakes are going to be made. Medical insurance companies will flag you, and then you might as well give up because it'll be very hard to get back on track. So you have to be very focused, not only with the preparation of the documentation, the selecting of the diagnosis and the procedure codes by the doctor, but also stay focused on the task at hand so that you do not jump from one thing to another and lose track of what you're doing. Why should you access medical benefits? How is it beneficial in the average dental practice? How is it beneficial in the specialty practice or a referral practice? How is it beneficial to just the basic practice that does only simple procedures and not complex surgical ones? First of all, why should you access medical benefits no matter what type of practice you're in? Because they're available for both oral and dental procedures. What's the difference? Oral procedures are bone and soft tissue procedures. Dental procedures are those that are performed on or in the tooth. Secondly, more insurance dollars for which the patient is already paying hefty premiums but not enjoying the benefits can be accessed for necessary treatment. We're not talking about cosmetic treatment. We're not talking about optional treatment. We're talking about necessary treatment. Dentists and patients are both completely unaware of the vast array of procedures performed in the mouth that are covered by medical plans. And lastly, patients, as you know, often decline necessary treatment due to the out-of-pocket cost. It's not, as many practice management people keep harping on in their lectures, that it's because the patient doesn't understand the value of the treatment. Patients understand the value of owning a Lamborghini, but if they can't afford one, if they can only afford a Kia, that's what they're going to purchase. So medical benefits come into play here, and they're very, very beneficial in helping patients pay for very necessary treatment. Many dentists may have tried to bill medical plans in the past, but because of their lack of knowledge as to how the process actually works, the specific terminology used, the documentation and format that's required for submission, they have failed. And so they've given up, and they tell patients it's not covered, when that's not the case at all. Also, are you aware that the deltas require a medical plan denial before paying for surgery, pathology, and appliances? And we're seeing other dental plans now following their lead. And do you know why that is? Why do they require that medical denial first before they will pay for it under their dental plan? It's because they know that currently there are medical benefits for all of the procedures that are going to be discussed in this program and many more. So dental insurance will not pay if the patient has medical plan coverage for these procedures. The other reason to access medical benefits, and probably even more important than the others, are that medical plans and medical insurance has no procedure limitations, no calendar year maximums, no lifetime maximums. So if you have to do 3, 4, 5, 10 exams a year for various reasons, each one of them is going to be covered. If you have to take multiple radiographs, orthopanograms, that's how we refer to the Panorexes, that's a brand name, multiple orthopanograms, or if you have to do multiple surgical procedures, such as bone grafts or tissue grafts or implants, there are no procedure limitations that you're going to be up against, no calendar year maximums, and no lifetime maximums. How refreshing is that? Dental insurance maximums, calendar year maximums, for as long as I've been in practice, have been the same: $1,000, $1,200, $1,500 a year. What does that pay for nowadays? Not a whole lot. When I started practicing, a prophy was $25. A crown was $200. You could replace fillings every 2 years. You could replace crowns every 5 years. Let me show you proof of medical reimbursement for oral procedures that are going to be discussed during this basic program. Only one of these examples is for a traumatic injury. These are actual EOBs for basic oral and dental procedures from the last 7 years. And you will see, no matter what the company, no matter what the procedure, they are covered under medical plans. Coverage is strictly based on the premium paid. Those who paid and purchased better insurance have better coverage. Those who paid for and purchased cheaper plans have cheaper coverage. Edit. These are actual EOBs from basic oral and dental procedures performed over the last 7 years. You will see that no matter what the procedure is, no matter how often it's done or what insurance company it is billed to, it is a billable procedure, it is a covered benefit. It is covered to a different extent depending on the type of plan the patient has purchased. Obviously, if they pay a higher premium, they're purchasing a better plan with better coverage, more extensive coverage, and are paying less out of pocket. And the opposite is true as well. You buy a cheaper plan, you pay less, premiums less, you get less in benefits. Makes sense. But for some reason, patients don't quite get it. The first example is for an emergency exam. This is not for a traumatic injury, where a periapical radiograph was done and an interim prosthesis inserted. Now notice in this situation, the interim prosthesis, which dental insurance and dental terminology terms a flipper is a dolphin, we don't use that term. So interim prosthesis is covered even though it's not a traumatic injury. Patient came in with a problem, exam was done, the interim prosthesis was paid. The second example shows how multiple exams, no matter how far apart or how close together they are all paid equally. This is an example from Aetna. 3 exams billed out within a very short time period, about 6 weeks, 3 exams, all were paid. CT scan, surgical stent, billed out. Now notice in this case, the patient had a cheaper plan, a cheaper policy, paid a lower premium. And here the benefit was 65% with the $600 deductible taken out. Well, one thing you'll notice regarding the deductibles is the deductible rarely has to be met in full up front before a plan will pay. The deductible is gradually eaten away with each claim that is submitted. Another example for a CT scan and a surgical stent. In this case, this was a Blue Cross Blue Shield affiliate, Empire, and you can see the greater benefit because the patient paid for a better, more extensive and comprehensive plan. A CT scan and interpretation. Here, this particular plan, this was a union plan, paid in full. An exam and a TMD orthotic, TRICARE. TRICARE is military coverage for active and retired military. TRICARE has excellent coverage under their medical policies. In this case, we have the TMD appliance billed. You can see the allowable was the amount billed, and the amount paid was the amount billed. Another example out of Michigan, exam and TMD orthotic. Again, you can see what the total cost billed was and what the payment was. So you can see as we go from plan to plan, the only thing that changes is what's paid out based on the type of a policy the patient has purchased and what the premium is that they are paying. Here's an example for an exam, an orthopanogram, and a TMD appliance. Again, you can see what was billed, what the allowable was, and what the policy paid. This is an example for Aetna, a point of service plan. You can see the TMD orthotic billed, and there's the payment. Another one, billed and paid. Now you can see this one was paid by quick remit. Some insurance companies, rather than sending you a check or rather than doing a direct deposit, if you have not requested it, will send you one of these debit cards. And you have to be very careful with them because obviously it is a card that anybody can use. So make sure that the companies that you have this arrangement with, that you have only trusted employees that have access to this type of a debit card. Otherwise, request from the insurance company that only direct deposits be made into your account or only that checks be sent to your office. Here's an example for a sleep apnea appliance. Now, one of the companies that we recommend for electronic filing, and actually the only company that we recommend to use for electronic filing is MDON. It is now called Change Healthcare. But you can see the type of report you're able to get and the type of information that you're able to get when using this service. It is a subscription service, a monthly subscription service. Here we had the billing for a sleep apnea appliance for $2,900 and paid in full. Again, you will notice that this was a TRICARE or military plan. Ridge preservation. Again, you can see the billing in this case was $950, the payment was 50%. This particular patient had a deductible taken out, had a copay amount, and the insurance net paid 50%. Also notice the comment at the bottom, and this is extremely important, and we will be discussing it during this program. Benefits on this claim were reduced because Oxford was not notified in advance of these services. In other words, pre-certification was not done. This was not an emergency service. This was an elective procedure. So therefore, the payment was less. Bone graft to the maxilla. Again, here we have another insurance company, and you can see what the payment is. So no matter what company, what procedure, freeze-dried bone graft in the maxilla, freeze-dried bone graft, 4 sites with ridge preservation, and a trauma case where endodontic therapy was done on 2 teeth with nitrous oxide analgesia and payment in full. It really doesn't matter what the company is, what the procedure is. Medical coverage is there. This example is for a sleep apnea appliance again. This is for Cigna. So you've got examples from all over the country from different insurance carriers, and consistently you see payments being made. Anthem, another sleep apnea appliance. You can see how great the benefits are under the patient's medical plans. Another interim prosthesis placed during surgery, no trauma. This was a situation where a patient has an abscess. A flipper was made. Again, we don't refer to it as a flipper. An interim prosthesis was placed and payment was made. In this example, we've got a final prosthesis, which were 3 crowns, and adjusted payment being made. Initially, Regents requested the money to be paid back, refunded. When we submitted an appeal, all of a sudden they changed their mind and they said, that's a valid argument, and they paid all but $50 on that. Again, this was not a trauma case. What about the situation that you commonly see in your practice where damage is due to a medication such as tetracycline? Patients don't expect or even know that medical insurance coverage exists. Dentists don't know that medical coverage exists, but this is due to a side effect of a medication. It is definitely medically necessary and related to a medical condition. In this case, 6 veneers were placed, and you can see the payment was close to $10,000. So those are just some examples of the procedures that are going to be discussed during this program. And I wanted to show you that it doesn't matter what state you're in. It doesn't matter what insurance company you're billing. These are all billable procedures. So are you convinced yet? Let's get started. What procedures are medically billable? We've got Dr. Z's top 10 list that I compiled from my experiences as a dentist and as a consultant working with commercial and government programs. The first is any traumatic injury to the mouth, whether dental or oral, and now you know the difference between the two, and treatment thereof. This includes all oral and dental procedures. Second category, exams for soft and hard tissue pathology. What if the patient has a normal exam and no pathology present? Can you not bill medical for an exam? Well, let me ask you this. What if the patient goes to a physician and has a normal checkup? No positive findings. Do the physicians not bill the exam to the medical plan? Of course they do. So even a normal, healthy checkup, that exam can be billed to the medical plan. Exams and consults in preparation for surgery can also be billed. As well, screening exams for oral cancer, where you're doing the visual exam, are also billable procedures. Using Visalite or Velscope are part of the visual oral cancer screening. If you're also requesting genetic, DNA, and caries susceptibility testing, those are separate procedures and have separate codes for billing purposes. Third category is emergency treatment of any oral inflammation or infection, such as a pericoronitis, a pizza burn, floss stuck between the teeth causing an abscess, draining fistula. No matter what the condition, if there's pain involved, inflammation, infection, even if you're not actually providing treatment, therapeutic or surgical treatment, if you're simply prescribing a medication, that examination is medically billable. Fourth category, stents, whether they are diagnostic, radiographic, or surgical stents. Each of those is covered typically to the tune of between $500 and $650. That's the typical range for coverage. Fifth category, medical radiographs. What are medical radiographs? They are radiographs in which most of the film shows structures other than teeth. In the mouth, medical radiographs are of two types. Screening radiographs, which are two-dimensional X-rays. These are routinely taken, and that's why they're called screening radiographs. If there are any suspicious lesions or positive findings, such as infection, abscess, cyst, pneumatization, atrophy, etc. Then a diagnostic radiograph can be taken. A diagnostic radiograph is a three-dimensional radiograph. What types of screening radiographs do we take in the dental office? Orthopanograms. Remember, that's the term for what you call a Panorex, which is a brand name. So orthopanograms, lateral jaw x-rays, occlusal films. So any two-dimensional radiograph where the majority of what you see is structures other than teeth. And then diagnostic radiographs. Diagnostic radiographs are the three-dimensional ones, the CT scans, where we're taking serial cuts through the jaw. They can be limited to a specific area, limited to a specific quadrant or side, or they can be full maxillofacial CT scans going from one TMJ to the other, all the way up to the base of the orbit and down to the lower border of the mandible. Dental radiographs, the periapicals, and full mouth x-rays are only billable to medical plans in situations involving traumatic injury. There are exceptions where they also may be paid in cases such as bulimia or ectodermal dysplasia, where a medical underlying condition exists. Sixth category is biopsies and excisions. What's the difference? Biopsies is where you remove part of a suspicious area, or you can do a brush biopsy or a smear. An excision is when you remove the whole lesion. Seventh category, extraction of teeth. When are extractions covered? Wisdom tooth extractions of impacted teeth, supernumeraries or mesiodens, ankylosed teeth, exposure of impacted teeth such as impacted canines in the palate, and the extraction of any teeth if traumatic injury is the cause. Additionally, extractions may be covered when performed at the request of a physician prior to specific surgeries, such as open heart surgery, transplants, hip and knee replacement, tumor removal, etc. The eighth category that's medically billable is any surgical procedure that is needed to rebuild or reconstruct jawbone that's due to bone loss, disuse, non-functional loading, or destruction because of an infectious process. As well, any surgical procedure that's needed to treat an infection or remove an infection, cyst, an abscess, those are all medically billable. Ninth category, prosthetics. Interim prosthetics are routinely covered when any surgical procedure is performed, whether it's elective surgery or emergency surgery. Both the interim and definitive or final prosthetics are covered when treatment is for a traumatic injury, if there is a medical condition that involves the teeth, such as meth addiction, bulimia, ectodermal dysplasia, etc., or medical treatment has affected the teeth. In other words, the teeth have been affected by medication that's been taken, chemotherapy, radiation, those types of medical treatments. And the 10th and last category on Dr. Z's top 10 list of medically billable procedures is appliances. Any removable or fixed appliance that is used to treat any type of dysfunction is medically billable. This includes night guards, TMD orthotics, palatal expansion, habit-breaking appliances, sleep apnea appliances, etc. So there you have it. Now, how can you access medical plan benefits for all of these procedures? Whether you access them for just some of them or for all of them, you have to go about it the right way. You must speak the medical billing and coding language. You have to be familiar with ICD-10 or diagnosis codes. You have to be familiar with CPT or procedure codes. And then you have to correctly complete the CMS 1500 claim form. The current version is the 0212 version. ICD-10 codes are diagnosis codes and are established by the World Health Organization. They are used across the globe. They describe the medical condition or presenting problem. The ICD-10 went into effect on October 1st of 2015. So if you were using ICD-9 codes, they are no longer valid as of that date. Only ICD-10 must be used on the medical claim form. CPT codes refer to current procedural terminology. These are procedure codes that are set by the American Medical Association, and they describe all diagnostic, therapeutic, or medical and surgical treatments that are performed. These codes are updated yearly, as are the ICD-10 codes, and they are constantly being revised, edited, added to, and deleted, which is why the Z-Book is also revised and updated on a yearly basis to address these changes and changes that occur with insurance company requirements and processing policies. Know that if you use an obsolete or deleted code after the expiration date, in other words, after December 31st, your claim will be rejected as not a covered benefit, even though benefits are available for the procedure, just the code has changed. But you have not kept up to date with the codes. And then what happens? I hear doctors telling their patients it's no longer a covered benefit. Well, yes, it is. But the codes changed for the current year. You billed with the previous year's codes, not realizing they were deleted or changed in some way. Insurance companies are not going to convert codes for you. It's not in their best interests. Keep in mind that insurance companies are not in the healthcare business. They are strictly in the business of making money. So they are not going to do anything to make it easier for you to get paid. The CMS 1500 claim form, the 0212 version, first of all, know that only medical codes can be used on this form. Dental codes can be used, but only in situations where you have impacted, ankylosed, or unerupted teeth that are being removed, and only these D codes can be used for certain insurers. In cases of traumatic injury or removal of teeth on the instruction of an MD, the simple surgical extraction code can also be billed, but that is not routinely covered. As far as the claim form goes, there's no need to order claim forms. We use Speedy Claims for the Z-Book. All those claim examples that are in the book, we use Speedy Claims to complete the claim forms. I've tried 12, 13, 14 different software versions from different companies for claim form completion. I found this one is the easiest, it's the most user-friendly that has been tested by us. You can either print out the completed claim form or you can upload the claims for e-filing. Simple as that. So there's no need to order the claim forms. The company that we use for Speedy Claims, you can download the software from speedysoftusa.com. We have an arrangement with them where Z Group clients who have taken the course, gone through the program, can get a discount on the software by using code DRZ10. Please know that we do not gain financial benefit from this. We strictly have made an arrangement for our clients to get a discount on this software. Notice also that this is a subscription service. It can be used both for completing and filing claims, although we do not recommend e-filing through this service. The 2017 Z-Book is revised this year. We added over 100 pages of new information, actually closer to 150. Every year the book is updated. Every year it's revised, it's changed. The examples are updated, modified. The documentation is updated to conform to current requirements in order to keep you current with changes in medical coding and billing protocols. This is what the Z-Book looks like. There's both a hard copy version and an e-book, a digital copy that you can access online from any device. If you're accessing it from your phone, it's only in the HTML version. If you're accessing from a laptop, a tablet, or a desktop computer, it is accessed on the cloud in interactive format. You will notice in the interactive ebook that if you hover over any website and click on, it will take you directly to that website. If you hover and click on our address, you're able to compose an email that will go directly to us.